Hello world, welcome to my channel Kundlas MD. Let's talk about the biggest improvement in artificial intelligence. What artificial intelligence is, or what I understand how it's going to be used in a healthcare system. First, if you have been a patient with multiple chronic medical problem and you know in the older days you have a big chart. Now, with artificial intelligence, the difference is your chart may have 1,000 pages. It will create a summary in 1 or 2 pager where I have a clear understanding of your current medications. If you saw any specialist, what they said, if you have x-ray, radiology, all those things, I'll be able to know it and I'll be taking care of those things. So that helps that your information is not buried down in a bigger chart. Second thing, the interconnectivity. People have different interests not to share the information, but with this AI, they can grab information from everywhere and they could present in a way it is understandable and actionable. If I want to query your data, I don't have to go through pages after pages. I'm a primary care physician. If I want to know when was the last time you had colonoscopy, in one click, I could find all your information. It will also make your data query so that we can act it properly and we could help you in a much better shape. For example, I am taking care of 1,000 diabetic patients. We know exactly based on science, if you're a diabetic, if your A1C is above this number, you are bound to have this many complications. If you have a high cholesterol or blood pressure, now I can query it. So that makes the healthcare even better. Now this information will be on their fingertips. So that should improve physicians' diagnostic capabilities and you should get a better treatment. Let's look at the second part. When you come to the office, we talk to you for 10-15 minutes. That whole discussion, if you allow, it will create a proper note. So when you leave the office, I'm not burdened with trying to recreate everything from my memory, and it will prevent physician burden. This conversation is a real time. Next thing is our seniors not to use artificial intelligence. 90% of our seniors are now texting with chatbots and all those things. You should be able to get very clear information. This artificial intelligence, if used properly, should help us and we will have a less physician burnout and burden. Thank you very much.